For some reason, it cut off when I got to subjective data, so rather than record the whole thing again, I'm just going to pick up where it left off. So your subjective data, headaches, any unusual, frequent, or severe headaches? Is there a change in headaches? Do you have a history of migraines? Head injury. Ever had any head injury? Describe that injury. Did you have loss of consciousness, which I put down here at that time with the injury? Dizziness and vertigo. We talked about the distinguishing between the two. Dizziness is a feeling lightheaded or swimming sensation, feeling like they faint, or do they have vertigo where the room is spinning? Have they had an actual diagnosis of vertigo? Seizures. Have they ever had a seizure, convulsion? When did they start getting them? How often do they occur? Are they on medication for tremors? Any shakes or tremors in the hands and face or anywhere in the body? When did they start? What makes them better and worse? Weakness. Any weakness or problem moving any part of the body? Is it generalized? Is it localized? Does it occur in conjunction with anything else? Incoordination or mobility. Do you have problems with balance, walking, falling? Which way do you fall? Forward, backwards, sideways? Do your legs seem to give out? Do you feel clumsy in your movement? Has your mobility changed where you have to use a device? Numbness or tingling sensation, which is paresthesia, which will be on our terms on the next slide. Does it feel like pins and needles? When did it start? Can you describe it? Does it occur when you get active? Do you have difficulty swallowing, which is dysphagia, which is on your next slide? Do you have difficulty speaking, which is also dysphagia, which is on your next slide? When did this start? Is it getting worse? With the swallowing, trouble swallowing liquids, trouble swallowing solids, trouble swallowing both? Anything else significant history I didn't ask about? Like, do you have a history of a stroke, cerebral vascular accident? Have you had any spinal cord injury, meningitis, encephalitis, any congenital defects, history of alcoholism, because that will cause impairments in nerves? Any environmental or occupational exposure? The last is our terminology. Okay, there's more than this, but these are the ones I felt were appropriate and pertinent at this point. You will learn others as you go along and apply them to disease processes. But amnesia is loss of memory. Analgesia is loss of pain sensation. Aphasia, loss of power of expression by speech, writing, or signs. Or it is the loss of comprehension of speech or written language. Ataxia, inability to perform coordinated movements. Ataxia you might see in a disorder such as Parkinson's. Coma, state of profound unconsciousness. Now, remember we have the Glasgow Coma Scale. Dysphagia, which we just discussed, was difficulty swallowing. Dysphagia is the difficulty speaking. Flaccid is loss of muscle tone or limp. Hemiplegia, loss of motor power or paralysis on one side of the body. Nystagmus, which we did in the eye, was a back and forth oscillation of the eyes. Oscillation is like a fan oscillating. Paralysis, decrease or loss of motor function. Paraplegia is impairment or loss of motor or sensory function in lower half of the body. Paresthesia, which I mentioned, is the sensation. It's an abnormal sensation. Can be burning, numbness, tingling, prickling of the skin. Spasticity is a continuous resistance to stretching with abnormal muscle tension and increased deep tendon reflex. Diagnosis is, which we showed on a previous slide, is recognizing objects by form, feel, size, or weight. A tic is a repetitive twitching, an inappropriate twitching of a muscle group such as a wink or grimace. 2-point discrimination was on a previous slide, ability to distinguish difference between two simultaneous pinpricks on the skin. And that is the end of this recording, I hope.